Susan Wells, licensed clinical social worker. During this webinar, you will learn top 5 strategies for taking control of your health and laying the groundwork for a healthy aging process. If you have questions for Susan, please click on the message box and type in the question. There will be 10 minutes available for Q&A at the end of the Susan's presentation. And also, please click on the mute button so that we can assure the presentation goes smoothly without much background noise. And I think you can just take from here, Susan. Thank you.
Thank you, Dahlia, and thanks everybody for taking time out of your Friday to be here today. If you have any trouble hearing me or you have any comments that you want me to see while the webinar is happening, please go ahead and send a message, as Dahlia said. Otherwise, we're going to have questions at the end. And because we have limited time today, if you find that there's an issue that you want to explore further with me, I'm going to have my contact information at the end. So I'm happy to answer an email or a phone call. I'm gearing today's presentation toward family caregivers because the Caregiver Coalition is sponsoring this webinar, but the information that we're going to talk about today is really useful for any of us. So I hope that you'll have some review today. No doubt you will have heard some of these things previously, but I also hope that there will be some new resources and perhaps some new ways of thinking about your health that you will also take away today. So let's dive in. One of the first things—
you can't put it back down.
Can everybody see slide 2? Dahlia, is that visible?
I don't know. I got in there, and now my name isn't on there anymore.
Okay.
Oh.
Dahlia, I can hear you.
Can you just put it down on the desk?
Yes, I can see the slides, but somebody else is talking. So I think you guys, if you guys can just mute, make sure that you're click the mute button. I'm trying to click on everybody's mute button because we have some background. Can you hear me now?
Yep.
Okay.
Working out the technical details.
Yes,
right,
those are always.
The first point, again, this is not news to any of you, especially if you're a family caregiver, but the most important thing in terms of taking charge of your health is making a conscious effort to have a healthy brain and body. And one of the things you probably heard a lot about in the news lately is the ill effects of social isolation. In fact, the National Health Service in England has made it a top priority in terms of their care of older adults. But the reason I'm bringing this up is because family caregivers can become quite isolated, especially if they're caring for someone who has dementia. Friends can drift away, not knowing what to say or feeling awkward, or simply because it's hard for them to see someone they care about going through Alzheimer's. So it's really important to stay connected as best you can to friends, colleagues, family members. Recently, there was a presenter, Dr. Brent Mosbach from UCSD. He's the principal investigator for the caregiver study there. And they're doing some interesting research around exposure to what they call pleasant events. And they're demonstrating that one of the things that can help family caregivers is making a conscious effort to engage in activities that help them feel energized, that bring joy to their life. And that this kind of pleasant event exposure can actually counteract the stress of caregiving and help with cardiovascular health. There's some really interesting studies or articles that have come out of the caregiver study, and if you Google UCSD caregiver study, you can read those. Cardiovascular health, as we all know, is linked to brain health and the prevention of dementia. And so paying attention to diet, exercise, and keeping regular medical appointments, those are all really important things. And again, it's not that we don't know this, but it's a different thing to actually plan these things into your day and prioritize yourself as much as you do that person that you're caring for. Another way to maintain healthy brain and body is to learn to set limits. Those of us who are caregivers, and I'm a long-distance family caregiver for a family member in the Midwest, as well as spending my day professionally in the caregiving role. So I have some experience with this. Learning to say no is hard sometimes, but it's what we need to do, again, to prevent burnout, to make sure that we are able to have some downtime and some time to attend to those activities that are going to keep us healthy. I want to spend a little bit of time talking about depression and anxiety because these are common conditions that family caregivers can face. And unfortunately, there is still stigma in our society around issues related to mental health. So I hope today I can help shatter some of that stigma as a clinical social worker and a geriatric care manager. I want you to know that it's perfectly normal response to being in a caregiver role to have moments of sadness or frustration, certainly. But if you find that those moments are more and more during your day, it may be that you are suffering a clinical depression or clinically significant anxiety. And so these are some of the symptoms I wanted to share with you that you should definitely talk to your doctor about, or if you are seeing a counselor or therapist, to just make note of the fact that sometimes depression and anxiety can show up in physical symptoms such as changes in sleep patterns, changes in appetite, rapid heartbeat for anxiety, fast breathing, trouble sleeping. But they can also show up in terms of your thought process and your mood. So feeling hopeless. From oftentimes in men, especially older men, depression may show up more as irritability versus tearfulness, for example. And certainly if you're having any thoughts about suicide or dying, those are things that you want to take seriously, just like you would if the person you're caring for were expressing those thoughts. We need to monitor our own thought process and seek help if we find that we are struggling with these symptoms. The second tip that I have is keep in touch with your doctor. One thing that I've seen a lot with family caregivers over the years, and I've been working with older people, people with dementia, and family caregivers for over 15 years, is that family caregivers can be very strong advocates for their loved one, but when it comes to their own health, they might have thoughts like, well, I don't want to bother my doctor, or maybe this issue isn't that big of a deal, I'm going to wait and see. And I find that sometimes family caregivers need extra encouragement to speak up on their own behalf. I have a family member who's going through cancer treatment right now, and the other day she was having a really terrible migraines, and she said to me, well, I don't want to be a bad patient. I'm just getting started with my treatment. I don't want to bother my doctor. And I said to her, first of all, people who are healthcare providers go into this work because they want to help their patients. But also, the reality is they frequently have many, many patients that they're taking care of, sometimes hundreds. So it's really impossible for them to know if you're having a problem. They're relying on you to reach out to them so they know if you're having symptoms or if there's something that isn't going right with your treatment. So again, I think it seems like common sense, but we can all fall into this trap where we don't want to burden others. So I encourage you to speak up and let people know, your care providers, what you're dealing with. Number 2, we all need to undergo preventative testing and regular appointments, like mammograms, like prostate cancer evaluations, like blood pressure checks, blood tests. These are important things that can be put off if you're not having an immediate issue. And I really encourage you to think about, Are you on track with all of this regular testing? Do you know your numbers when it comes to cardiovascular health? If the answer is no, maybe that's one piece of homework that you can take away today, is looking up when your last appointments were and getting some new ones scheduled. When you go to the doctor, you know you have limited time. That's the reality right now in our healthcare system. So it's really important for you to prioritize what are the top two or three concerns that you really want to make sure that you talk to your doctor about. Sometimes when we're working with clients, care management clients, we will actually send a fax to the doctor ahead of time. And fax machines are kind of dinosaurs at this point, but still very effective in terms of communication with care providers. And that gives the doctor a chance to review your concerns in advance and think about it a little bit before you actually meet. But if you're not able to do that, you can also write them down. And I actually sometimes will hand the list to my doctor, because some doctors can process things better when they're reading them. And then we have a conversation about the issues. We're going to talk about electronic medical records a little bit more later, but this is another wonderful development that I think really facilitates communication between physician and patient, where you can send your doctor an email now. In most of the major health systems here in San Diego, there is a MyChart or some kind of electronic medical record that makes it very easy for you to email with your care provider. And finally, as far as communication with your healthcare providers, don't be afraid to see a specialist or ask for a referral to a specialist if you feel like you want that. As you all probably know, certain insurances, such as HMOs, require you to go through a process to get a referral for a specialist. But other health insurances, such as traditional Medicare, don't require a referral in many cases. So it's really helpful if you are experiencing a problem that isn't getting better, or if you just in your gut level feel like, gosh, I'd really like to see somebody who has expertise in this area, to go ahead and pursue that. I have seen clients, family caregivers, as well as older people we work with who put that off. Again, sort of not wanting to bother the care providers, or perhaps thinking, well, if I wait, maybe it'll get better. And the reality is things can actually get worse if you wait, oftentimes. So I just want to encourage you to prioritize yourself and your health, and be that wonderful advocate for yourself that you are for the person you're caring for. Okay. So electronic medical records, we talked about those. I'm curious if you want to add in the comments section if you've had positive experiences with electronic medical records, or what your thoughts are about them. Because my own personal experience, as far as working with my family members and myself, has been very positive, but also as far as like being a care manager, being able to track my clients' history is really helpful, because in the medical record, you can look up past lab results, of course, having the permission of the client to do so. You can see when past appointments are, you can see the physician's notes from the appointment, and you can print all of this out. So as far as, my opinion is this is an extremely useful tool in terms of managing your own health history and remembering, what happened when, and especially with immunizations, for example. There's a lot of immunizations that we all are encouraged to have by the federal government, and there's some wonderful tools online where you can find out, given your age, sort of what you should be tracking in terms of your immunization record. So being able to print that out from your electronic medical record and compare it to the national recommendations is really useful. As I mentioned, emailing your doctor This used to be, I'm sure many of you know, just basically unheard of. Before the last 10 years or even 5 years, there was no way really to email your doctor. So I think this has been a huge time saver, and I think has also improved the relationship between physician and patient when you know that your physician is responsive and easily contacted. And sometimes they'll have their staff respond to you, so you may not have a direct line, so to speak, with your physician, but usually questions can get answered pretty quickly in my experience. And lastly, again, I'm curious about your experience, but more and more providers are offering telemedicine options. For example, I know a psychologist who is doing a lot of psychotherapy through telemedicine. And basically what that means is you can be in the comfort of your own home and having a session with a care provider without having to get in the car and drive to that person's location. So again, in my view, this is a wonderful tool for family caregivers because we know how hard it is sometimes to get out of the house. You may have an easier time facilitating a family member or friend coming over to be with your loved one for an hour versus maybe 3 hours if you have to drive somewhere, have an appointment, and then drive back. So I encourage you to look into that with your care providers or your health system as a convenient option. Okay, so make sure I didn't just skip over. Okay. So another thing that I'd like to have you think about is creating or updating your advance directives. And this is an hour-long talk in and of itself, but just to plant the seed, if you haven't already, experts suggest that any adult age 18 or over needs to have a healthcare advance directive. What you see here on your screen is an example of an advance directive called a POLST, which stands for Physician Order for Life-Sustaining Treatment. This particular advance directive is really geared towards people who have serious or chronic illness or who are elderly. The one that people, there's a document called a Power of Attorney for Healthcare, which is typically what younger people will have, but it's also useful for an older person as well because you can get into more detail about what you want to happen if you're in a situation where you cannot articulate what you want to happen in a medical setting. I really can't stress enough how important it is that you have one of these for yourself. I was a hospital social worker before I entered the field of care management, and I worked on a stroke and general rehab unit in a well-known rehab hospital. And we saw a number of patients who were in their 30s, 40s, 50s, who did not ever expect to have a stroke, and yet they did. And in some cases, they had documents set up like this. In other cases, they didn't. And it can really be very stressful and difficult for the patient, their family, and also for the healthcare providers if there isn't documentation as far as who do you want to be your decision maker if you're unable to speak or communicate. Equally important is putting into place a power of attorney for property, which is similarly, it tells people who do you want to be your financial decision maker if you are unable to make decisions for yourself. And again, going back to my hospital experience, I remember I had a patient who had a stroke and it affected him cognitively. So at that point, he could not execute legally an advance directive form. And his family was unable to access his bank account, so they couldn't pay his rent, they couldn't pay his other bills. It was a very stressful time for all of them. So I hope that if you haven't already, you will look into creating an advance directive for health and for property. And right here are some resources for you. California has a standardized advanced healthcare directive form. You just Google those words because the link was extremely long and complicated, so I didn't copy it here. But you don't need an attorney to create this document. You are encouraged to talk to the person you're appointing as your decision maker, because you want to make sure that person is willing and able to act in that role, and also that they are understanding what you want and can accurately represent your wishes. The Conversation Project is a great nonprofit that has a whole lot of tools to help you have those conversations with your elected decision maker or your loved ones who may be reluctant to talk about future planning. There's a few more resources here. The Coalition for Compassionate Care is the organization in California that has created the PULSE document, and you can find that form on their website. You're also encouraged to talk to an estate planning or elder law attorney if you would like to create a full estate plan, which includes a will, a last will and testament, as well as the documents that we talked about today. And that NALA is an organization where you can look up reputable attorneys. And then Elder Law and Advocacy is a wonderful organization, nonprofit here in San Diego that the county helps to fund, which provides low or no cost legal advice. Another tip is, as you're taking care of your health, it's important to know what benefits are available to you. And being a social worker, I've always been fascinated by this issue of community resources. And having worked with a lot of people over the years, I find that many times people are not aware of the fact that they are eligible for certain benefits, whether it's through health insurance through the government, or if they are a veteran, veterans benefits. There are nonprofits in San Diego that serve family caregivers and people with dementia. And then, of course, housing is a huge issue for many people. So there are also some government programs, but also some nonprofits that are doing some great work in the area of housing. So how do you find out which benefits you are eligible for? Again, this could be a whole training in and of itself, but there are resources out there. So number one, the county has some fantastic experts that you can call at Aging and Independent Services or 211. And if you tell them what you need, they're going to link you with the appropriate service here in San Diego. There are also companies that specialize in Medi-Cal, for instance, who employ former Medi-Cal employees who really understand the ins and outs of Medi-Cal and can kind of walk you through that. As I mentioned, there are elder law and estate planning attorneys. There's many wonderful people doing that kind of work here in San Diego. Veteran services organizations are there to help you if you are a veteran or caring for a veteran to understand what benefits you are eligible for, and then to actually help you with the application process, which can be overwhelming, frankly. So it is extremely helpful and advisable to work with a VSO if you're applying for veterans benefits. Aging Life Care Managers, also known as geriatric care managers, that's what I do. We have a national association, aginglifecare.org is the website, and you can search for care managers in your zip code area. If you find that you or your loved one are in the hospital, you can also work with the social worker there and the discharge planners. They have a wealth of information. And then finally, benefitscheckup.org is it's a resource that people should be more aware of, that they aren't. But you can go there and type in some information about yourself, and they will generate a list for you of all of the benefits that you may be eligible for. So that is a really great first step that I encourage you to take. Long-term care options. So you might be wondering, why am I bringing up long-term care? You might be in your 30s or your 40s or even your 20s. This is something that we all need to think about now, basically, because long-term care, and what I mean by long-term care is who is going to take care of us if we are at the point where we become disabled or we need daily assistance. And because people are living longer and living longer with chronic illness, the chances that all of us are going to need some kind of care as we age is very likely. And the reason that I'm going to go back to this picture for a moment, a maze listed or shown here is that it does feel like that sometimes, where the terminology is confusing, the levels of care don't make sense unless you've had some experience with it, and then understanding how it all gets paid for. So here are just a few examples of terminology that are used to describe different levels of care. So you've probably heard some or all of these: skilled nursing, intermediate care, or custodial care, memory care, which is actually a subset of assisted living, which is also called residential care facilities for the elderly. Then we have independent living, and then we have senior apartments. And then as far as the cost and funding, that's all just depends on the level. But health insurance will pay for some of this, not all of it. That's a common question that I get is, well, wait a minute, doesn't Medicare pay for all of this? And the answer is, unfortunately, no. That's where long-term care insurance can come in. And then, of course, we all need to be saving as best we can for the future. And I know that is much easier said than done. But so if you look at some of the articles in some of the financial publications, there's a lot of concern about people saving for retirement and being able to pay for long-term care. And finally, there are some tools out there that may benefit you or your loved one if you are struggling to pay for care. Reverse mortgage is helpful for some people, and there are some guidelines put into place legally to ensure that older people who look into this option do receive objective counseling as to whether it is the correct or a viable option for them. So long-term care, how do you learn more about it? Well, fortunately, again, San Diego has a lot of resources. I've listed a few of them here. Choose Well is a program of San Diego County, and it lists a lot of different RCFEs, residential care facilities for the elderly, and has a rating system for them. CANR, California Advocates for Nursing Home Reform, has a wealth of information about nursing homes, so skilled nursing and intermediate care. Consumer Advocates for RCFE Reform has a lot of great information about RCFEs, assisted living. And then you'll find some general financial articles on ARP and nextavenue.org, and offered through continuing education classes through the OSHER programs at San Diego State and UCSD, where there are classes about planning for long-term care and being your own advocate in the long-term care system. So there's a lot of wonderful resources out there. That's my presentation. Wow, I got it right at noon, so hooray. This is my contact information, so please feel free to email me or call me. I know we just really touched on the tip of the iceberg today, so certainly I'm happy to help if you have questions that are bigger than what we can cover in the next section here.
Thank you, Susan. That was really informative. And yes, you're right on 30 minutes mark, I think. So great timing. So if you guys have a question for Susan, there is a little box that looks like a little bubble, and that's a message box, and you can just type in the question, and we can answer it today. Or if you have a question at a later time, you can definitely email Susan. That's the email on the screen, and or call her, I guess, any time of the day. Susan?
8:30 to 5.
Yes. So let's give everyone about a couple minutes to see if there's questions. If not, like I said before, I'm recording this webinar, and it's going to be on the Caregiver Coalition website for later viewing. And you guys have questions at a later time, you can always call or email Susan. How was this experience for you, Susan?
Great. I could talk for the entire day about this.
Yeah, that's right. Okay. Let's see. If there is no questions, I can just thank you, Susan, for participating today. And I know it's always so hard for me to find webinar speakers, but now you can tell everyone how this is actually easy. It's not that hard, and what a wonderful opportunity.
Yes, I will spread the word. Thank you very much for everybody coming today. I appreciate it.
Yeah. Thank you. And our next webinar is going to be on September 21st. And this one, like I said before, is going to be it's recorded and uploaded to our website. Thank you, Susan.
Thank you. Have a great day, everybody.
Have a great weekend, everybody.
Bye-bye.